Hi, this is Mel from Howzit, where we talk all things immigration and Canada. So today I've got the great privilege of talking to Tanya and little Emily about their story. It's something that you're going to love to hear. They've going to tell us about how Emily came into their world, and she's just absolutely changed it. So welcome to Tanya, and hello to Emily. It's wonderful having you here. Look at that smile. And I'm going to just ask you, tell me about yourself and Emily and how you got to Canada.
So we immigrated to Canada in end of April 2018. Me, my husband, and we brought along 2 dogs. And we stayed in a little town called Brantford for 3 months. And then we moved to Kitchener.
So you've got 2 dogs you mentioned. They're quite big dogs from what I can recall. And you brought them over with you as well. Was that a problem getting some accommodation and that sorted? Because I know that people say that it's difficult getting a rental with dogs.
Yes, so we brought along the 2 dogs, and my husband was still working online from back home. So we just looked for Airbnb that accommodated the 2 dogs. And then as long as he can work from home and they accommodated the dogs, we didn't worry about what area we wanted to stay. And that's why we chose Brantford. And then on weekends, we would hire a vehicle and just do road trips and go look at different areas and towns and decided where we wanted to stay permanently. And we found Kitchener and we just loved it.
So Kitchener tell me about Kitchener. How does it look and what made you love Kitchener?
What made us love Kitchener is it made us think of home. So home in South Africa was Pretoria East. And like I always explain it to my friends, it's being in the city without having to be in the city. So we just loved it because it was busy. There are big places there. Google is there, BlackBerry is there. But it's small enough to, no matter where you are, you can easily get to where you want to be. I drive 5 minutes to work. My husband drives maybe 15 minutes to work, and everything is close by. Lots of parks, lots of little tiny shopping centers, and very family orientated. Lots of splash pads. People are always walking around. It's really a very nice place.
And was it how did you get over the immigration and finding your feet? Did you settle in quite easily? Was it a difficult process for you guys, or did you kind of find you are home and this is going to be your new adventure?
I think the first few weeks my husband was still a little bit wanting to check the locks at night and making sure everything is locked and safe, and as soon as he hears something at night, then he would check to see what's wrong or what was it or anything. I, within the first 2-3 days, felt totally safe. We were walking around 9-10 o'clock at night, taking the dogs for a walk, and I just felt safe. And that's what I loved. So I immediately started enjoying it, and we would go on shopping excursions, and when we see specials, start shopping for our home. And I just saw it as a new chapter to our life book.
Yeah, and it's April, so spring is here and the flowers started coming out. It's a beautiful time to be in Canada and to start settling in, right?
Yeah, definitely. We had a few windy days, so it always made me think of Cape Town. 1 minute it's windy and you just have to make sure your dress stays down, and the next minute the sun is shining, and 2 minutes later it's raining. So it's fun, and we went shopping the one time and halfway home it started raining. So, and I actually thought it was very funny. I enjoyed it. My husband, not so much.
So then the exciting journey came along. You fell pregnant while you were just here, and tell us more about that story. What happened from there onwards?
So I found out I was pregnant at the end of 2018. I just started working for an accounting firm, and it was very hard because we didn't have a family doctor just yet. So there's a lot of trying to figure out who is still taking in new patients, because not all doctors are accepting new patients. and then there's sometimes a waiting list, and you being under the stress because you know you're pregnant, you need to get a checkup. You need to make sure everything is fine, especially since I had a miscarriage a few months before. And it was a hard time. But then everything fell in place. We got a doula, so she was there for the moral support, making sure you have all the information that you need and know what tests are going to happen when. I got a family doctor because as soon as they find out that you are pregnant, they jump you up on the waiting list. So
your priority kind of gets...
Yeah, you become a red flag. So they quickly help you. And it was scary because at the end of 2018, I had a bladder infection. So that made us had a trip to the hospital. And the same thing there, your waiting areas at the hospital is very long. But once they see that you are pregnant, and if you are classified as a code red to them, they do bump you up, and your waiting time in the hospital does become a lot less.
And your visits to the doctor, so do you go straight into a gynecologist like you would do in South Africa, or do you have, you say you've got a house doctor? And how regularly do you see that doctor? And you've also had a doula, you said.
Yeah. So the doula, they're not medically inclined. So they basically just make sure that you have all the information. Yes. And so you mostly see your family doctor, who will do your checkups and everything in your normal family office. And then once you're at about, you go into your 20 weeks, you would first see you'll have your first appointment with a gynecologist. You also do have appointment sheets that they give you when you have to go to an imaging company to be able to do your ultrasounds and stuff like that. But you do see your family doctor for the first few months, about every 6 to 8 weeks.
So Emily decided by 20 weeks she's going to change plans slightly. Tell us about what happened and the journey from there forward.
Yeah, so I needed to go for my 19-week checkup, which we did, and then they measure everything internally, and they do like a full in-depth scan. And I actually went back to South Africa to visit my family and friends at 19 weeks. Went for a nice 3D ultrasound then in Cape Town and found out it was a little girl. When I came back, they told me that they had some trouble seeing some of her stuff, being able to measure some of her organs because she was very, very busy. So we went for a second scan, and they phoned me a day or two after, and they said they needed to check 1 or 2 more things that they just needed to double check on. So I went for my third scan at True North. And there the ultrasound lady told me that they were having trouble picking up one of her kidneys. So a little bit scared, but I also know that only having one kidney is not as bad as it sounds, although it is scary.
So we've just put her down and she's relaxed, and we can continue chatting about, so then they checked you and they asked you for a third checkup. Just to check if everything is, and 1 kidney, and which is scary, I'm sure.
Yeah.
But you know about it. Tell us what happened.
So at that point, they gave us a referral to go to one of the children's hospitals, the close one being in Hamilton, which is about an hour's drive from Kitchener. So we actually went there. My appointment was the day after my birthday, so it was on the beginning of April. And they did 2 scans there as well, where one measures the blood flow, and then the other one just also does the internal check, measuring all the organs, checking if everything is at the right spot, and so on. And there the doctor called us in, and they said that they could confirm that she only has 1 kidney, but they said that was not a problem to them at all, but they have a new concern. So at that moment, my heart was like, okay, it just dropped. And then they said to me, so the second scan that they did was measuring the blood flow, and that there was a blood flow problem between my body and the uterus, and then from the uterus to the baby. but her blood flow was fine. So they were happy with that. So they immediately told me that they were going to admit me to the emergency room, and they started giving me steroids injections, and they admitted me that day. It was a Monday. And so they would, after 24 hours, give me the second round of steroids, and about twice or 3 times a day they would do a test on her, which is called a no stress test. It's basically just bands that they put around your body and just monitoring how busy she is and how active and does she kick and stuff like that. And then I also had to check how busy she was. So if she was lying still for more than an hour, I needed to call the doctors. But she was doing great. Until the Thursday, she was fine, busy as hell. When the doctors would put their hands on my tummy to feel something, she would kick them. If they needed to put machines on to listen to her heartbeat, she would kick the machine away. So she was very happy in her little swimming pool, as I called it. And on the Thursday, I just started having cramps in my chest and not feeling very well. And they immediately pushed me to labor and delivery, and my blood pressure was going through the roof. And yeah, I had called my husband, listen, I think you should get to the hospital. And he first thought I was joking because I was actually supposed to be discharged that day. But when he got to the hospital, I was as white as a piece of paper. My blood pressure was 210 over 180, I think it was.
Wow.
And they said that my internal organs were busy shutting down and they needed to take her out immediately. So she was born at 24 weeks and 2 days.
Wow.
Yeah.
So she was born at 24 weeks and
Yeah.
she weighed, I remember you telling me this, she weighed 425 grams, right?
470 grams, which
My
is
word.
1.05 pounds.
A pound.
Yeah,
How
1
crazy is
pound.
that?
A pound of butter, as we would always say.
And what happened with her there? What was the procedure like when they took her out and started looking up after you? That must have been quite a manic process and time.
Yeah, so they immediately, I went in for emergency C-section. They took her out, I think it was in less than 20 minutes. They was out. They had a NICU team. It's called, I can't even remember. They have a NICU online team that stays right outside the door. And as soon as she's out of the tummy, they rush in, they get her, they start cleaning her up, cleaning her airways. Let me just pick her up again. And then they immediately started checking her. She was breathing at least, so they were very happy, but they needed to intubate her. And then they immediately changed her. They have like a temporary room called the ISR. And then she was in the ISR while they were getting her cubicle ready in the NICU. And then they moved her to the NICU, and she was there on life support and on oxygen and everything like that. And then they started looking at me after me, and I was in my emergency room for about 2 days. I wasn't allowed to get out of bed for the first 24 hours, so I was not allowed to see her. They helped me immediately starting to try and get out some milk and stuff like that. And then Daddy was able to take the little one of 2 drops that I did get out at the moment, was able to go give it to her on a little earbud that they just swab inside the mouth.
Wow.
Yeah.
One moment you're pregnant and the next moment you've got a baby, and it's been a crazy time. That emotions must have been all over, understanding what's going to happen and looking at where you've come to right up to where you've got a smiling little face like this. It's just been nothing short of a miracle that you guys have been. The support, I'm sure, tell us, the medical system really came through for you guys in this time.
Yeah.
How did your medical bills look? How did they look after you guys?
So she was in hospital for 162 days. She was transferred from the high-risk hospital at about 130 days. We were transferred to the local hospital in Kitchener because she didn't need any more oxygen and stuff like that. So yeah, she was in hospital for 162 days, and for the whole 162 days, we didn't pay 1 cent, not $1, not 1 cent.
Okay.
The only expenses we had were for rooms that I got at a place called the Ronald McDonald House, which is an amazing organization where you can sleep. We sleep a block away from your child and you can come and go as you please. And that was the only expenses I had.
Wow.
Yeah, you want to go play? So yeah.
And did she need any medical specialized care during this time and still now? How does that look, and what was offered to you?
So her medical care started a lot when she got discharged. So up until she was in the hospital, everything was done there. She did need some additional eye treatments and checkups that we got transferred to Hamilton once every 2-3 weeks. There would be an ambulance that takes us to Hamilton. She would get her eyes checked and then back to the local hospital where we were staying. And once she got discharged, we would see her pediatrician, dietitian, and physiotherapist every 2 to 3 weeks at the hospital. And she, after a while, they were not happy with her feeding, so she started needing some more additional care in regards to that. So that was a little bit extra when it comes to feeding specialists, the occupational therapists. But at the moment, she was referred to sick kids, so that's usually a bunch of specialists that help and support the babies at home. That is all provided by the government. You get 4 or 5 appointments per season. So whether it be summer, fall, winter, you get your 4 appointments or so. And then that's usually in center, but during COVID, it's been all online, so via Zoom appointments. And so she would get that, and then they help us with her feeding, checking her up developmentally, making sure she can do everything that she needs to do, and then also just helping her get to where she needs to be.
Wow. So you were talking about the Ronald McDonald House and those kind of things. That's become quite a passion of you, and you must have seen quite a few stories that would have touched your heart, and that's changed kind of literally where you are right now. Tell us about what you've seen during that time and what you've experienced.
Yeah, so even when I was in South Africa, I've always had a passion for kids. Kids just pulled at my heartstrings. And the more they needed, the more love they just got from me. I always used to help out with the cupcakes for kids with cancer, and always thought that when I'm coming to Canada, Canada is big on just helping each other, and it's a friendly country. So when I came here, I said that once I'm on my feet, it's something that I want to do. Being in the NICU nurses and the staff there are amazing. I could go home every night not being worried that something's going to happen to my child. I knew she would be okay because she had the best of care. The Ronald McDonald House is almost like a hostel, hotel type of thing that is a block away from these big hospitals. And it provides family accommodation so that they could be close to their kids. I could sleep at the Ronald McDonald House. They provided you breakfast and lunch and dinner, and you could come and go as you please. There was coffee, there was cool drinks, there were laundry facilities.
Wow.
In
a lot of care for you.
It's very, very relaxing atmosphere. The rooms are very comfortable, there's television, the staff is amazing. And it just helps families be able to be, for those who maybe have kids at home, they could stay at the Ronald McDonald House. So while the mom and dad is looking after the one child, the other mom or dad is able to go and be with the child in the hospital. And the Ronald McDonald House works mostly on donations. So that's really something that I would love to help out with in the future. And then also, I recall a few times seeing babies or kids in the hospital parents who got bad news, and your heart would break for them. Or I remember going to the lounge the one day and seeing a toddler. The baby was probably not much older than Emily, still had that little penguin waggle, and Dad was walking alongside him, pushing his cancer medication on an IV pole, and you know it happens, and there are kids with cancer or even other illnesses, and it just, when you see it really breaks you, and sometimes you just want to bring them some love, and you just want to just show them some normalcy,
and some compassion.
Yeah.
You can't but not change who you are and your life, because you want to make a difference because of what you're seeing and what you've experienced.
Yeah, you want to show the moms and the parents and the families that they're not alone, that someone is thinking about them and is praying for them. And you also want to show the kids, you want them to have a little bit of fun, because the beginning of their life started with medical tests and exams and hospital rooms and doctors and treatments, and some of those treatments cannot be very easy to go through, and sometimes I feel like they just need a day or two in their life when they maybe need it the most to just have a fun day and just be able to celebrate life at that moment. So yeah, that's something that I can maybe hope to do in the future.
Oh, great. So you're going to be you're going to start doing some initiatives to be part of that, and we'll support it on Howzit and tell people about that, so that we can also make a difference.
Yes.
It's not, as immigrants, it's a give and take, and you want to give back, and that's exactly what you're doing right now, because of your life just changed, your and your husband's life being completely and utterly changed.
Yeah.
Of where you are. Your career has obviously, have taken a different kind of route.
Yeah.
How does that look right now? Are you going back to work? How does maternity leave have, that must have been a different perspective as well for you.
Yes. So because I had enough working hours before I had to go on maternity leave, I was able to qualify for your maternity leave in Canada. While she was in hospital, I was on a leave that the government gives you called the family caregiver leave. So that's usually a leave where if you have someone in your family that needs your attention 24 hours and need you to thrive and to live, then you go on a family caregiver leave. So my maternity leave only started when she came home, which was about a year ago today. And then you have two options. You can either take the 12-month maternity leave, or you can go for a lower rate maternity leave, and then it's over 18 months. So my maternity leave ends at the end of this month. I'll be going back to work, but because of her special needs and all her doctor appointments and stuff that she still currently has to try and help her, and COVID, I'll be having to work from home, trying to work while she's sleeping or doesn't have appointments, maybe working at night while she's sleeping or daddy's available. I wasn't also not able to look for a higher paying job, so I've got a very minimum wage job. But they're amazing. They support me, and I can have very flexible hours. I can come and go as I please. I can work from home. If I do need to go to the office, I can take her with me, which is nice. But it doesn't really help out financially too much, because she still has a lot of appointments that take an hour or so, and then it affects her schedule. Yeah. So because of her feeding problems, you can't feed her before some appointments. You have to wait till after. Other appointments you can feed during the time, but because it's also specialists, you can't really be too picky on the time of the appointment. So everything goes hand in hand with each other.
But you've got the care, which is great. You've got that support, and you've got that supporting system. How did you, if we look at your family and friends, both here and in South Africa, how did you've just come here, you've been here a little while, then Emily gets born. You need a strong support structure.
Yes.
How do you overcome that, and how have you built that to make sure that you get the support that you would need? to thrive?
Yeah, so we were lucky enough to meet some South Africans in Kitchener before Emily was born. So when she was born that early, we met some amazing people who brought my husband food while I was in hospital, or brought us some food that we can reheat when I get home at 7 o'clock at night after being 2 hours on the road. We also met some amazing people who were there just mentally willing to take our dog for a walk, or just giving us any type of support. Sometimes you need to get away from the hospital, so we had some friends and distant family just come and pop in and take us for lunch, or just some difference, just some being outside the hospital for a few minutes or a few hours. And that really, really helped. As much as you want to be with your child, you do need to take that break for an hour or two.
Yeah.
Just a change of scenery does really so much. And family back home were very supportive, checking up regularly. But also, I think what helps a lot is being understanding, because being in the hospital, holding this tiny, tiny little thing, she was as long as a ruler. She was 30 centimeters, and you were trying to manage this tiny little thing with more cables around her than anything. And so you weren't always free to be able to check in with people or give them updates on her progress. And what really, really helped is that your family back home were understanding of that they gave you your space to answer when you can, and to give them progress updates when you can, and not be too pressurized on you for those updates.
That's great, because you can say to the family, if they are understanding, you can tell them what you would need, because it's tough as is to come to a new country and then suddenly having a baby. You've not had much preparation, and then kind of just settling into life and what that looks like. So this is Emily.
Yes.
And she's incredible. She's got a smile that just lights up a room, and it's amazing the journey that she's been. How old is she now? Tell us.
So they work on 2 ages. They work on her actual age, so from the day that she was born. So she's about 17 months now, but corrected from working from her due date when she was supposed to be born. Developmentally, she is 13 months.
And she's crawling already. It's great seeing her walking around, and as I say, she's got a smile that just make you want to laugh with her, which is incredible.
Yeah.
So looking back through this whole journey, and from when you started, what would you tell yourself about this whole process, about the pregnancy, about everything? What would you say?
Wow, it's something that I thought about really, and couldn't really get to anything that I would say, but definitely learn to let go.
Yeah.
Live it day by day, and just try and enjoy it. It's very hard having a preemie. She looks healthy, and she is healthy for most but there are stuff that she does struggle with. And trying to be the perfect mom, trying to be the perfect wife, there is no such thing.
Doesn't exist. Yeah.
And you need to learn to let go. You need to learn just to live it day by day. And when she doesn't want to eat, when she doesn't want to do her things that she's supposed to be doing,
it's okay.
Yeah, it's okay. That's definitely, she's special. And she's definitely showed us that she's boss, and she will do things at her own time. Yeah.
That's great.
Yes.
It's been great chatting to you, and
Thank you.
we look forward to seeing the progress and supporting you and Emily
Yes.
in making a difference in children's lives.
Say bye.